A major measles outbreak here in Ontario appears to have stabilized. That's according to Ontario's top doctor. But even though the worst may have passed, officials say it's important to stay vigilant and make sure you are up to date on your vaccines. Here to discuss is the Associate Medical Officer of Health in Toronto, Dr. Allison Chris. Thank you so much for being with us here today. The messaging is important. I do want to put things into perspective here with the numbers the province is releasing on the cases we've seen between October 2024 and just last week. 572 cases of the measles were reported. What kind of factors led to this virus taking hold once again? This is your work. You speak about it in more of a public sense. It's not every single day we get some idea of just how many numbers are coming in.
So I think what we have now is a local experience in the province of Ontario of how transmissible the measles virus can be in under and unimmunized populations. We also know that measles continues to circulate across the globe, and we will likely continue to have importations of cases and exposures within the city of Toronto. So we need to continue to be very vigilant in our approach to measles. And it's a really good opportunity of the reminder that vaccines are very protective. We know measles is a vaccine-preventable disease. With 2 doses of the vaccine, you are near 100% protected from severe illness and getting infection. And it's an opportunity for us to really remind the public of those messages.
There's been a huge focus on education, as well as you mentioned vaccines here, and making sure the public stays up to date on their shots. Who should be getting vaccinated for the measles?
I'm going to talk a little bit about the role of Toronto Public Health and our role in maintaining and mitigating measles. We monitor and do surveillance. What that means is measles is a reportable disease. Any case within the City of Toronto is reported to Toronto Public Health to be investigated. That enables us to monitor the situation. Currently in 2025, Toronto Public Health has had 2 confirmed cases of measles. That's different than what we're hearing across the province, and we really want to remind the public that this is the time to be vigilant and get vaccinated. We also have a prevention program that focuses on increasing access to vaccines and public education about the importance of vaccines. We also offer some vaccine clinics that you can find available on the Toronto Public Health website. The third thing that Toronto Public Health would be doing is case and contact management. And these are the situations when we have a case reported or we have contacts or an exposure within the city. And our role there is to really put out that fire. A case of measles can lead to up to 15 to 20 subsequent cases in an unvaccinated population.
That's a lot of people. You find out the individual who tested positive for measles, where they were, who they were with. And so what sort of symptoms does somebody have to look out for when it comes to the measles, and who's at high risk?
So measles symptoms include a fever, cough, runny nose, red watery eyes, and potentially additional complications that can be ear infections, pneumonia, encephalitis, hospitalization, and sometimes death. The most pathognomonic or really indicative of measles is a rash that starts on the face, it's blotchy, progresses throughout the torso and the body.
Like the images we just saw on the screen.
Exactly. So that's the real indicator. Some of the symptoms can look like other viral illnesses, but it's that high fever and the collection of those symptoms. Another thing that we really look for is that history, a history of travel, and we always are asking our clients about their vaccine history, and that helps us to understand, could this be a confirmed case of measles?
Are there concerns for any long-term symptoms? Is there such thing as long-term impacts from the measles?
You know, certainly, and that's something I feel that in our current health promotion messaging, we're not speaking a lot about. We've not had a substantial number of cases in the province or within Canada since we've eliminated measles now almost 30 years ago, and we don't really see these long-term effects. It can actually impact your immune system. It can impact your ability to respond to other viruses and bacteria following the infection, and it can lead to a very rare complication impacting the brain.
Okay, so I know that Toronto Public Health, you're doing a lot of work when it comes to prevention, education, but what would it take for this outbreak to reemerge in our population? I know that we said things are stable right now.
So one of the things we do in the City of Toronto is we do have the Provincial Act, the Immunization of School Pupils Act, that enables Toronto Public Health to assess the records for vaccine coverage of all students within the city. And we continue to do that to ensure we have high coverage. Some of these programs were impacted over the last 5 years when we were responding to the COVID-19 pandemic. But we continue to do that assessment, and generally, we continue to have higher levels of vaccine coverage for the measles virus, so that's going to continue to protect our community.
Okay, and hopefully the numbers will continue to stabilize there with all the work that you're doing.
Yes, exactly. And other things, we really want the population and our community to really be mindful when they travel, to ensure they're vaccinated before their travel with 2 doses of the measles-containing virus for best protection, and to look for signs and symptoms if you return from areas where we see higher measles activity. And at this point in time, that's many different places in the world.
Okay, Dr. Allison Chris, thank you so much for taking the time to speak with us.